From Rochester, Minnesota, is the president and CEO of the Mayo Clinic, Dr. Dennis Cortese. He was recently at this table for a Washington Journal. Nice to see you again, Doctor.
Susan, good to see you.
The president specifically laid out a number of health care priorities. Before we talk about some of them, what do you think about the will of this town to get at the problem of health care with the economy in the state that it's in?
That's a difficult one to answer about the will in Washington, but it certainly is a priority that needs to be addressed. I think the approach to thinking about health care and trying to reform it from top to bottom is appropriate, and certainly getting people insured and beginning to look about the issue of how do we get better value for what we actually provide to our patients. How do we get better care, better outcomes, better safety is exactly the right approach, and this is the time to take it on. So I certainly would agree with people who want to address healthcare reform now.
On the issue of the goals, which is every American having coverage, the president said it could be paid for in part by efficiencies in the current system. You've had a lot of experience with delivery of health care at the Mayo Clinic. Is the president right?
He's exactly right. When you look at the ability to make the system more efficient, and you look throughout the United States at the different types of practices that take place, we can see wide ranges in efficiency and effectiveness in different regions of the country. And the ranges can go so far to the extent that we can predict that there's at least 30 to maybe 40% efficiency that can be gained if we focus on finding the very best practice patterns, the very best care deliverers, and make sure we foster that other parts of the country practice the same way. And if we can do that, indeed there are efficiencies that can be attained over the next several years. It would take a while to get a return on that investment, but the statement that efficiencies are there is certainly true.
A couple of other issues that he highlighted, and these are ones we've heard you talk about as well, is the need to convert medical health records to electronic format.
Well, yes, and that's a significant issue, because it raises the question of, if we are going to electrify the practice, automate the practice, what is it that we want to attain out of that? What's the real vision for the use of electronic medical records? And I think that if the vision is to just automate what we're currently doing, we're missing a huge opportunity. The vision should be, how do we turn the electronic environment into supporting the learning organization concept, where everybody can learn together what is the very best practice, the very best care, particularly for an individual patient. To do that, you have to have an information structure that connects to each other, plugs and plays, as we say, that it has to actually be interoperable, so one system can communicate to the other just like we can do on the internet. And then finally, it has to be a tool that distributes knowledge, not just helps us pay bills and collect revenue, but much more importantly, it becomes an electronic environment that helps us make better decisions for patients, particularly at the moment that we're caring for the patients in that office. As your commenter, who was the teacher, said, it's one person at a time. That is exactly true in healthcare. Healthcare is delivered one person at a time, and it's delivered by the nurse or the physician that's interacting with the patient, whether they're together or whether they're at a distance. That's where the real magic takes place in healthcare, and electronic environment should be designed with that vision in mind to support that kind of interaction.
The president also called for a specific goal to find a cure for cancer. And I'm wondering if you had a chance to lobby for one particular disease that the country would focus on finding a cure for. Would it be cancer?
Well, I'll answer your question two ways, Susan. One, first, cancer is not a disease. It's not a single disease. It's a compilation of many, many different diseases. As a matter of fact, just in the one segment of, let's say, breast cancer, there are at least 120 to 130 types of breast cancer that we can identify based on gene markings and protein markings that make it quite different on how we design the treatment for individual patients. So cancer is not a single disease.
Dr. Dennis Cortese, who at the Mayo Clinic has been very involved in the national debate over health care delivery. Thank you, sir, for being with C-SPAN this evening.
You're welcome.